Healthcare workers are the backbone of our society. Yet, behind their professional facades, many healthcare workers carry a heavy burden, their own mental health struggles. For years, healthcare professionals have been expected to be invincible, to power through long hours and emotionally draining situations without showing weakness. This culture of silence has created an environment where seeking help for mental health concerns is often seen as a sign of weakness or incompetence. The COVID-19 pandemic brought the mental health crisis in healthcare to the forefront, exposing the immense pressure and trauma these individuals face daily. Healthcare workers on the front lines faced unprecedented levels of death and suffering, often without adequate support or resources. This has led to a surge in mental health issues, including anxiety, depression, post-traumatic stress disorder, and even suicidal thoughts. The mental health crisis among healthcare workers is a global phenomenon. Studies reveal alarming rates of burnout, compassion fatigue, and psychological distress among doctors, nurses, and other healthcare professionals. The World Health Organization has recognized this as a major public health concern, emphasizing the urgent need for interventions. Burnout and mental health issues can lead to decreased job satisfaction, increased medical errors, and a decline in the quality of patient care. Addressing this crisis is crucial for the well-being of healthcare workers and the health and safety of the patients they serve. Healthcare workers are not just medical professionals. They are human beings with their own emotions, vulnerabilities, and personal lives. They go to work every day, facing life and death situations, witnessing suffering, and carrying the weight of their patients' well-being on their shoulders. The emotional toll of caring for sick and dying patients can take a significant toll on their mental health. It is time to break the silence surrounding mental health in healthcare and create a culture where seeking help is seen as a sign of strength. One of the most significant contributors to stress and burnout among healthcare workers is the sheer number of hours they work. Long shifts, often extending beyond the traditional 8-hour workday, are the norm in many healthcare settings. Sleep deprivation, exhaustion, and a lack of work-life balance become the norm, taking a toll on both physical and mental health. The constant pressure to be available can lead to feelings of resentment, isolation, and burnout. The lack of adequate time for rest and recovery further exacerbates the problem, creating a vicious cycle of exhaustion and stress. The emotional toll of working in healthcare is often underestimated. Healthcare professionals are exposed to human suffering daily, witnessing pain, illness, and death firsthand. While empathy is a cornerstone of compassionate care, the constant exposure to emotionally charged situations can lead to compassion fatigue. Healthcare workers are often expected to remain composed and professional in the face of tragedy, suppressing their own emotions. This emotional suppression can have long-term consequences, contributing to burnout, anxiety, and depression. Systemic factors within the healthcare system contribute significantly to stress and burnout among healthcare workers. Staff shortages place an immense burden on existing staff, who are often required to take on larger patient loads and work longer hours. The pressure to do more with less can be overwhelming, leading to feelings of inadequacy and moral distress. Bureaucratic tasks, such as paperwork and administrative duties, often take time away from direct patient care. Addressing the systemic issues within healthcare is crucial to creating a more supportive and sustainable work environment. The consequences of stress and burnout extend far beyond the walls of hospitals and clinics, seeping into the personal lives of healthcare workers. The long hours and emotional exhaustion they experience at work can leave them feeling depleted and disconnected from their loved ones. They may struggle to be fully present at home, carrying the weight of their work burdens into their personal lives. The lack of energy and emotional availability can strain relationships, leading to misunderstandings and conflicts. Healthcare workers may withdraw from social activities, hobbies, and interests they once enjoyed. Sleep disturbances, such as insomnia, are common, as are physical symptoms like headaches and muscle tension. The constant pressure to be strong can prevent healthcare workers from seeking help when they need it most. The impact of stress and burnout on healthcare workers extends beyond their personal lives, creating a ripple effect that impacts the quality of care they provide. When healthcare professionals are emotionally depleted and physically exhausted, their ability to deliver compassionate, attentive care is compromised. Burnout can lead to cynicism, detachment, and a decreased sense of empathy, making it challenging for healthcare workers to connect with their patients. Patients may perceive this detachment as a lack of caring or concern, eroding trust and impacting the patient provider relationship. High levels of stress and burnout contribute to increased absenteeism and turnover rates among healthcare workers, exacerbating staffing shortages. Identifying the signs of stress and burnout in ourselves and our colleagues is crucial for early intervention and prevention. Common warning signs include persistent fatigue, irritability, difficulty sleeping, changes in appetite, and withdrawal from social activities. Physical symptoms such as headaches and muscle tension can also be indicative of chronic stress. Changes in job performance, such as increased errors or difficulty concentrating, may signal that a healthcare worker is struggling. Encouraging a culture of openness and support within healthcare settings is essential for breaking down the stigma associated with mental health. I value your thoughts and experiences. Please share your feedback by commenting below. Navigating the demanding landscape of healthcare requires resilience, the ability to bounce back from adversity and maintain well-being amidst challenges. Mindfulness, a practice that encourages focusing on the present moment, can help calm the mind and reduce anxiety. Physical activity is another potent antidote to stress, releasing endorphins that have mood-boosting effects. Prioritizing sleep is crucial for physical and mental recovery, allowing the body and mind to rest and recharge. Establishing a consistent sleep schedule and creating a relaxing bedtime routine can significantly improve sleep quality. The journey to well-being is not one to be undertaken alone. Seeking support from colleagues, friends, and family is essential for navigating the challenges of working in healthcare. Peer support groups provide a safe and confidential space to share experiences and develop coping strategies. These groups foster a sense of community and shared understanding, reminding healthcare professionals that they are not alone in their struggles. Beyond peer support, seeking professional help from therapists or counselors specializing in healthcare worker mental health can provide invaluable guidance. Remember, seeking professional help is a sign of strength and self awareness, not weakness. Addressing the systemic factors contributing to stress and burnout within healthcare requires a paradigm shift at the institutional level. Hospitals and healthcare organizations must prioritize the well being of their staff, recognizing that a healthy and supported workforce is essential for providing high quality patient care. Implementing policies that promote work life balance, such as flexible scheduling options and generous leave policies, can significantly reduce stress. Creating a culture of respect and appreciation for healthcare workers where their contributions are valued is paramount. Investing in mental health resources, such as on site counseling services and peer support programs, is crucial for providing healthcare workers with the support they need. The mental health of healthcare workers is not just an individual responsibility, it is a societal imperative. These dedicated individuals tirelessly care for us in our times of need, often putting their own well being on the line. It is our collective responsibility to ensure that they have the support, resources, and compassion they need to navigate the unique challenges of their profession. We all must move beyond the culture of silence and stigma surrounding mental health in healthcare. Investing in the mental health of healthcare workers is not just the right thing to do, it is the smart thing to do. When healthcare workers are healthy, supported, and resilient, they are better equipped to provide compassionate, high quality care to their patients. The mental well being of our healthcare workers is a shared responsibility of healthcare institutions, policymakers, and society. We all must create a supportive ecosystem that enables them to thrive. This begins with fostering a culture of openness where mental health concerns are met with empathy. Open dialogues should be encouraged, normalizing the act of seeking help. Supervisors play a crucial role by promoting mental health resources and creating safe spaces, implementing fair working hours and manageable workloads is crucial for preventing burnout. Imagine a future where seeking help for mental health is as accepted as seeking treatment for physical ailments. A future where healthcare workers prioritize their well being without fear of judgment. This vision requires a societal shift, recognizing mental health as integral to overall well being. Together, we must create solutions that prioritize the mental health of our healthcare heroes. This includes advocating for increased funding, supporting research, and promoting mental health awareness campaigns. By working together, we can pave the way towards a brighter future where healthcare workers feel supported and empowered. While systemic change is essential, small acts of kindness can have a ripple effect. Each one of us has the power to make a difference. A simple thank you to your doctor or nurse, a heartfelt note of appreciation, or a small gesture of kindness can boost morale. Show our healthcare heroes they are seen, valued, and appreciated. Be patient and understanding with healthcare professionals. Recognize they are doing their best under stressful circumstances. Extend grace and compassion to those who care for us. Let us rise to the challenge of becoming champions of care, not just for those who are unwell, but for those who dedicate their lives to healing. By fostering a culture of compassion, support, and understanding, we create a ripple effect of positivity. Together, let's transform the healthcare landscape into one where mental health is prioritized. Let your actions be a testament to the profound respect and gratitude we hold for healthcare heroes. For in their well being lies the well being of us all.